Hello, my name is Tom Hurrle. I've practiced acupuncture for 14 years in Chicago. This continues my written interview on Conscious Health Institute, and want to tell you that I still find, after a decade and a half, that what I do is magical. And I say that because while the effect of acupuncture when a needle is inserted is not so surprising, when the needle is not inserted and one still obtains an effect, this is surprising. And though it happens to me day after day and time after time, I still find wonder in it. My teacher encourages us to treat ourselves using a non-insertive technique. And what I experience when I do that is demonstrates the hypothesis that the effect of superficial or non-insertive needling occurs through the connective tissue. The fascia in the connective tissue in the body are electroconductive, and through touching an acupuncture point, I can send a signal through the fascia that affects whole planes of the body. Of course, they're related to channels. The acupuncture channels is defined classically. And the experience is quite remarkable. As said in the written interview, for most people, it means that they'll shift from the stressful state of everyday life where the sympathetic fight or flight nervous system is active to the relaxation state, rest and repair functions of the parasympathetic nervous system. So this occurs quite quickly. Once it does occur, then I proceed to treat symptoms using the needle to change patterns of circulation related to the symptoms. And that's all there is to it, so we'll take a look. I am going to listen to Barbara's pulses. We listen to 6 pulses on each wrist. I'm going to determine the relative strength of those 6 pulses and treat the weakest area in the body. Of course, I've already spoken with Barbara and I understand her complaints and something about her. So listening to the different pulse positions, which is strong, which is weak, which is rough, which is soft. Barbara is typically, she's a spleen pattern, and she is today as well. So I have here a thin gold needle which I am going to touch to the skin in points that will supplement appropriately. I stroke the skin and palpate for the point. An acupuncture point can equally be called a hole, an acupuncture hole. I place the needle in the tube on the skin, rest the needle on the skin, remove the tube, and the needle is not inserted. However, I position my left hand very carefully, and I may manipulate the needle just a little bit. I am looking for the arrival of qi, that moment when the wind blows away the clouds, exposing a clear blue sky. I look for a change at the tip of the needle. The tip of the needle gets heavy. I remove the needle and I close the hole. So we're going to do one more spot which is designed to supplement where it's needed. I stroke the skin to resolve little areas of tension within the skin. I palpate carefully for a difference in the skin and subcutaneous tissues that will identify the hole that I want to use. I've identified it. I place the needle. Now notice I just place the needle. I don't push it in because it's not going to be inserted. The needle is resting on the surface of the skin in this carefully positioned left hand. At this point in an actual treatment, it's very quiet. All my attention is on the tip of the needle. One can imagine the needle is an antenna, and I am an extension of the antenna. So there was a change. So I closed the hole to prevent the qi from leaking out and went on from there. So then we'll come and check the pulse and see if we got a desired change. Oh, much softer, much nicer. It needs more though, so we're going to do the other foot. Won't take long. Stroke, find the point. It's a hole, find the hole, place the needle, close the left thumb and forefinger, just push the needle a little bit. These gold needles are pretty blunt, they don't go in very easily. Adjust the left hand, a little rotation on the needle to encourage this electroconductive reaction through the connective tissue. There we go. A little catch at the end, a little change. We're going to finish this very brief demonstration by something that I do with many people, both because it helps with stress and because it's great cosmetically. We're going to take a silver needle this time, and we're going to do these points by the end of the eyebrow, which are nice cosmetically because they relieve wrinkles, they're nice because they clear the sinus, and they're nice because they initiate a particular pattern of movement in the body.